Thank you. Okay, and we do have quite a bit of people from our CST in attendance here today, including some colleagues of mine that you've met on the Monday session. And so we won't do any reintroductions for them, but just so you know, we have representation from the ambulatory team, our informatics surgical team, medication management, provider education, order sets you met last on Monday, as well as registration and RSDQ. So we have a whole slew of people hoping to get this clinic through go live. In terms of the agenda, it's essentially going through, again, really high level overview of what the enterprise is for clinics, the role, the purpose, as well as then just jumping right into gathering some data from you. So you're aware of what the purpose is and what the CST project is about, a system that we're implementing all throughout the 3 health authorities for VCH, PHSA, and PHC. And we have guiding principles that we work under in terms of how we enact this system change. And so I'm not going to go through over this as well. You're probably really familiar with all of this. So no changes for the sake of change. We have to meet safety, regulatory, financial, and content parameters in order to make the system work. Again, is we're trying to enterprise design is our focus, where we configure the design based on what can be applicable throughout the enterprise and what the standardization will be. And our priority is the must-have. So for what the clinic truly requires so that go live will be successful, but not to say that we won't have any discussions further for optimization down the line after go live as well. That is certainly on the table. It's just the focus right now would be the bare essentials. Again, you know what your role is as a subject matter expert, and thank you for participating in this design. We will be reaching out to you for your expertise on the clinic and what you prefer in order to assist your workflow, as well as the workflows of your colleagues in the clinic as well. And so we're supposed to go over kind of an enterprise overview of what a typical clinic with provider looks like. So again, you're familiar with this. Typically, it starts off with a referral. Which can be an external, so it's a fax that's received, or an internal referral where the order comes in through Cerner itself. The referrals are typically screened and triaged, and they can be either rejected or accepted. The scheduling process then takes place in the system where the patient confirms the appointment. And then on the day of the actual clinic visit, they will check in with the registration, and the encounter will be fully activated for that visit. The patient then is seen by the clinicians, such as yourself, nursing and allied, as well as accounting for things during that visit, documentation, orders, treatments, etc. And there are certain equivalents to that, including how medications are signed for and how procedures are documented. And finally, when the clinic visit is complete, there are prescriptions, lab requisitions, which we discussed on Monday as well, can be sent out or given to the patient. And the encounter for that visit has then concluded and will be discharged. So just jumping.
I'm so sorry.
Yeah.
So I don't screen the referrals.
Yes.
Yeah.
Perfect. Yeah. So that is just one of the little nuances that are slightly different for the burn clinic that we did. Thank you for confirming that no provider triage is being done at this clinic. Essentially, every referral that you receive, they will schedule to be seen by yourself. So what we know is that there are no direct admit patients for this clinic. The type of treatments that are provided are dressing changes such as wound debridement. There's compression garment fittings, some cortisone injections for scar management. So this was just taken from a survey that we had generally given out to the clinic and was completed by one of the clinicians over there. So it's very general. So please let me know if we're missing something.
So what does
there,
direct admit mean? That they just walk in?
yes,
Okay.
no walk-ins.
Yeah.
Yeah. You don't conduct telehealth appointments for this clinic. Yeah. And you currently don't have like a standard PPO as well for this clinic, which again, we had discussed on Monday.
Yeah.
Okay. So no provider triage done. So the clinic receives the fax referral, which will now go into the system, and the clerk will schedule that in to see you. The process of the clerk scheduling the appointments in future state will be discussed in a separate scheduling session with that clerk. I believe it's Aubrey for your clinic. And so that process is going to be hashed out with her then. And so after that, after it's scheduled, essentially is your visit day. And so during your visit day, just some questions that we have. Do you have standard note templates that you use when you make your notes or when you dictate?
I don't, but now that everything's going to Cerner, that probably would be a good idea because it's very similar to like 3/4 of the patients.
So we can definitely offer note templates that we can have auto text set up for you. So they can consist of drop down selections, different ways to configure it so that you can just make your few selections. It'll be directly related to what's pulled in from the patient's chart. So it'd be very quick for you to make your note in the future. Fessor is also available as well when the clinic goes live, so we can discuss that more and have that optimized to your settings as you need.
Yeah.
Great. And so in terms of appointment types, is it just the one standard appointment type that you have for the clinic? Or are there different types of appointments that you require to be laid out scheduling wise?
Well, there are a few different types. So one is like an acute, like a new consult
Okay.
that never been seen there before. And then the second one would be a follow-up.
Okay.
And then the third one would be like a scar consult. And then the fourth one would be like post-surgical follow-ups.
Okay, so new consult, that makes sense. Follow-up makes sense. The SCAR consult, is that something that you let the clerk know now that it's a SCAR consult, or is that something that's already is part of the referral? Like, how do you differentiate that with the other?
So I don't see those referrals, right? Because they've all gone to the clerks who just give the appointment.
Oh, I see. Okay,
Right? So, but that's not like, it's not a new burn.
I
It's
see.
somebody, for example, who had a burn 10 years ago, and now they have a scar contracture in their neck that they need electively fixed.
So would you like to have that as a separate appointment type versus just a follow-up or slash a new
Well,
consult?
it's not a follow-up. That's kind of what I'm getting at, and it's not an acute wound. Does it have to be a separate type of appointment? Not necessarily, but you asked if there was different appointment types, and these are the
Yes.
different types that we have.
Okay. And
So
post-surgical.
sorry about that. So then our conclusion is that the clerk is able to glean that this is that type of referral, and they'll automatically put them into that appointment type for their schedule.
Yeah, they should be able to see that from the
Yeah.
referral. Yeah.
Okay.
Thank you. Standard letters, I don't know, do you have anything that you
No,
distribute to your patients? Any specific? No, okay.
no.
Are there other specialists or clinics that you typically refer out to pretty commonly?
Rarely. One might be a hand surgeon. So within plastics, so hand surgery, rarely orthopedics. That's like internal referrals, that's pretty much it, because we don't really have psychiatry consult options here.
So for those internal consults, you just give them a call now, or is it a fax?
Well, I usually just copy them on my notes from that day. And
Okay.
that acts as a like a referral or a consult request.
Okay, and if the clerk is documenting that in the system on the referring document, then that will auto distribute to the referring provider as well when you sign those clinic notes. There's no need to, or their name will appear for you to add them to your distribution when you
Yeah.
sign in future state.
Okay.
Are there, I think this was just touched on as well on Monday, if you have any common prescriptions that you write
Yeah,
for patients?
it's usually just pain medications.
Okay, so we do have that option as well to include that in the order sets to have it even routed to the specific pharmacy for these patients. So that is an option that we can explore.
I
I
mean,
know,
there's gonna be like 4 or 5 different medications that are the only ones that I pretty much ever prescribe from that clinic. So if those like 4 or 5 are there and easy, like a drop down menu or whatever it is, just to click and print pretty much, that would be very helpful.
and in terms of reports, are there any specific reports you pull right now, like data for the burn clinic that you want to continue having for the future? I believe we had discussed a provider compensation billing report for the ortho clinic. I'm not sure if that's
No, I don't need that.
okay. Okay. Is there any other questions about reports to my team? We'll be good with that.
No questions from me.
Thank you. So moving along. So I just wanted to see, so for the workflow for your clinic visit, you have the patient come in, they register, they check in with the clerk, and then they get brought in to one of the beds within that clinic space. And I believe you have a working list of your patients that's kind of just there on the table, and they mark it up and what location the patient is in and whatnot. So for future state, you can still continue with that. That report can the patient list essentially can be printed for the day if you would like. Also within Cerner itself, there is ambulatory organizer. I'm sure you're familiar with that application, where you can organize your patients for the day as well. We just had some questions about research. Are there research patients seen for the burn clinic?
There will be.
Okay. Is there any information about that we need to consider in terms of access or who's
No,
involved?
not really. All the research related clinic visits happen while they're having their actual regular follow-ups. So there's no additional visits for the research purposes.
Okay. Is there a separate clinician that's involved, or is it just yourself?
Just well, myself, and then we had a research assistant who left her job, so we're in the process of hiring a new one. But he or she would be there when we have these research visits.
Okay. So no separate appointment type. It'll just be scheduled in as part of
The regular
your
follow-up. Yeah.
typical follow-up.
Yeah.
Okay, in terms of documenting on these patients, is there specific kind of worksheets or anything like that you need to complete or nursing needs to complete?
There will be, but that's got nothing to do with Cerner. So
Okay.
it will be totally separate.
Okay, so it'll be out of system workflows for research patients.
Correct.
Okay. Is there anyone, someone raised their, Kinson?
Oh, hi, Dr. Pap. This is
Hi.
Kinson from Meds Management. I just wanted to double check. Your research isn't based on medications, right? Or is it just
It will be on a topical cream.
gotcha? I'll just note that down and bring that back to my team. Thank you. Oh, and are you planning to start this research soon, Dr. Pap?
Yeah, hopefully in the next couple of months.
Couple of months. Gotcha.
Yeah.
Thank
Yeah.
you.
Any other questions for research? Okay. Moving along. So we just wanted to call out some differences for the future state workflow. I know we had spoken to some Diamond Health Clinic, other providers that use the dictation service through PCIS. So just letting you know that that won't be available anymore with the patients that you see with a Cerner appointment and Cerner encounter. Private MOAs will not have access to build your encounters or appointments in Cerner. So I'm not sure if that's happening now. But the clinic clerk has all of that scheduling functionality. And then the clerical staff will need to build those, again, encounters or appointments that you see in, that you see in the office. They can be done by the clerical staff at the Burns Clinic.
So yeah, I didn't get that last part.
So essentially there was a workflow where the MOAs before can build encounters and essentially accounts to have patients seen within the clinic, but done through the private sector. I don't know if that's applicable to you, if that's something that
No.
you were doing. Okay. So then this is not applicable then.
No.
Okay. So we do have some additional questions for you to configure the clinic. Jen, did you want to take over or did you want me to continue on with this?
I can do the next slide, but do we have Andy for medical service?
Yep, I'm here.
Thanks, Andy.
Hey, yeah, thanks. I can speak to this slide quickly. So, Dr. Pap, this is just a slide to confirm the medical service that will be assigned to your clinic and what patients will be registered under to kind of just show what services they're receiving from the clinic. So it's just used to support the encounter search, and you can help use medical services to kind of form lists and sort your patients through that way. So I think the medical services listed here proposed are general surgery, orthopedic surgery, plastic surgery, and vascular surgery. Do these are these applicable to your clinic, all of them, or is there
No, just plastics.
just plastics?
Yeah.
Okay, perfect. We'll make sure just plastics is in there then for the medical service.
In the inpatient space, do you use anything that's Burns medical services? Is it always plastics wherever you go? There's no unique medical service for your inpatient care, right, Dr. Bell?
Not that I know
Okay, that's great.
Just a FYI, there actually is a design decision to
Yes.
add Burns as a medical service.
Yes, I've seen that. Yes.
Okay, so it might be available in the future depending on the outcome of this ticket.
of. Good to know. Nice to hear about it.
So assuming
Yes.
that if it does proceed with build for that service, we'll assume that you would prefer to use that, correct?
Yes.
Okay, perfect. Thank you.
Okay, I can take these slides. Hi, Dr. Pap. I'm JP. I worked with you on the wound clinic. So just a few things just want to hash out for this Burns clinic. On the left, we have the referral order that we're going to build for you. It's called Referral to Outpatient Burn Clinic. I wanted to ask if you would like a reference text to pop up for these internal providers that are placing this order to your clinic.
What does that mean?
Meaning, like, is there any inclusion or exclusion criteria that needs to be identified? Do they need to send in any documentation, results, diagnostics, any of those type of requirements that need to be sent over or identified when they place the order?
Well, I mean, it has to be something burn related.
Mhm.
So I mean, like for example, if you look at the list that you have here on the sample, chronic non-healing wounds, osteo, diabetic foot, and so forth. So none of those would be applicable.
Right.
Burns would, obviously, or like scarring from burns. Those are pretty
Scarring.
much the only two indications that we see burn patients
Okay.
in the clinic.
Okay. So what I can do is I
Or
can mock
referral.
up a sample and email it to you just to get your thumbs up before we move forward with it.
Sure.
Okay, next slide, please. Now this is for also when the referral comes in. We had a auto text created for complex wounds.
Yeah.
Is there anything needed for the burn clinic specific for the documentation that you need to view?
Yeah, it would be nice. It'll make it easier.
Okay, so here's on the example. Reason for referral, does that sound okay? And then we can do
So
burn
is this
details.
sorry, is this for the referral?
Yeah, this is for the referral.
Okay, yeah, certain, do you want me to tell you now, or do you want to send
Um,
me a list and then I'll just modify it?
let's do that. I'll send you a list and we can modify. It'll be on the same email.
Okay,
Okay, sounds good. Next, please. This one we can skip. We're confirming there is no triage here. Then I just want to confirm we're going to build a follow-up order for this clinic. I know there's a follow-up and then the post-op, so we'll add the post-op follow-up to this list as well. And then there's also a nurse follow-up for nurse visits only. Is there anything else that pops into your mind besides
there's
those
also
three?
an occupational therapist only follow-up.
Occupational therapist only, okay. Thank you. And this one, there's an order called continuing care follow-up. Do you see patients in the inpatient space for burns at VGH or UBC today? And do they follow up in the clinic with you after discharge?
Yeah, I mean, every single burn patient who's in the burn unit gets a follow-up in the burn clinic.
Okay. So we'll make this order available for you and then you'll be able to select VGH Burn Clinic. So that way it'll go to the clerk to go ahead and book this follow-up appointment.
Yeah.
Sounds good. Next, please. Clinic flag. Now we did build a clinic flag for VGH wound. Do you see a need for a clinic flag for the burn clinic? I guess one of the big indicators would be, do you want to get a notification for when your patients are admitted to an inpatient or ED space? Because we can send a notification to an inbox.
Well, yeah, sure. Emerge pretty much would be the
Emerge.
one.
Okay. I'll mark that as a yes, and we will demo that at validation. And then we can skip the clinic flag ones. Requisition manager. So this is a tool that houses all of the requisitions on the orders that you place. So if you place a lab or a diagnostic or medical imaging order, they flow to this tool and the clerk can then action off of it by either printing the requisition or making comments. Since you're the only provider there and I think there's only one or two clerks, I guess I can say the first, by default, all orders, so labs, anything that has a requisition, when you place that order, it'll auto print to the nearest printer. And then that's one option. I guess I can go to the next two slides, please. 32. Okay. So this is requisition printing options. So the first one is to use that tool. which allows the clerks to print the requisition, so you don't have to, and we don't have to worry about it auto printing and saving paper. Option 2 is to manually print the requisitions. Either you can, if you need to say, if you did an x-ray and hand that over to the patient for to have that done, or you can have the clerk print it. And then we have option 3, which is single printing and then or having it auto print. So how do you handle requisitions today?
Well, I just fill out the form and give it to the patient.
Okay. Is that for all imaging and labs?
Well, you know, I do imaging maybe 10 times a year, so it's very rare.
Mhm.
So that, you know, that doesn't, I don't really care how that happens because it's probably less than
Different view.
once a month. You know, one order, so that doesn't really matter how that comes. The most common one that we do order is the culture and sensitivity. So that's pretty much the only rec that I do.
Okay. I think what's probably best is we don't need to go through the requisition manager because someone does need to manage it and complete them off the queue or print them. We can just continue with the standard of as soon as you place that order, that rec will print to the nearest printer and then you can
Sure.
hand it off to the patient.
Yeah,
Okay.
that's good.
We'll go with option 3. Thank you. Next slide, please. So this is a decision we need for the ambulatory organizer. Do you feel a need to build rooms for this clinic? So once the patient's checked in, the clerk can indicate which room the patient's in or bay.
Yeah, I'd probably, you know, being maybe old fashioned, but the list on the table is just so much easier rather than going to the computer and check where my next patient is.
Right, no, understandable.
Again,
can
when there's
continue.
like 30 patients, I don't want to do that 30 times a day just to see which bed I have to go to.
Gotcha. Okay, we'll stick with the current state.
Just to note, the previous design session for the ortho team, I think they whittled it down to 3 or 4 locations, just for the nursing staff to keep track of where their patients are. But that's because, you know, some of their patients go to x-ray and then come back and whatnot and do in the weight room. So would that be beneficial if it's just like kind of general areas, or you still really leaning towards that paper list? Like it would be waiting room and then just clinic space or clinic area, essentially.
Yeah, I don't need more than that. The only time they leave the burn clinic is if they have to go to the bathroom. And I don't think that's going to be an option for your placement there. So yeah, waiting area in clinic, that's all it needs.
Sounds good. Okay, so message center pulls. We did build these for a wound as well, where you can send messages to a pool, or the clerks and the clinical staff can send messages to the pool as well. This is good as if there's multiple providers in the clinic, given you're the only provider here. Do you see a need to build? I don't think there's a need for a provider pool. When you send messages,
The pool is very small.
right? What about the
but-
nursing staff?
Yeah, but I mean, sure, if there's something that I'd like to relay a message to the burn clinic nurses or the clerks.
Mhm.
I mean, the pool is nice, so I don't have to go specifically try to find individual names.
Right, okay. So we can go forward with the clinical and the admin pool. And the nice thing is once you say, if you send a message to one of the nurses can actually assign themselves to that message. So it doesn't get lost and they can actually filter and sort through that as well.
Okay.
Thank you. Next, clinic inbox. Now this I don't see is the best solution for you. For your orders that you place or documentation, do you there is no other clinician of the day. Are the other providers responsible for reviewing results or your documents or signing off on anything? I mean, I'm pretty sure it's all you. Okay. So this will be a no. We don't need to build a clinic inbox. Everything will go directly to you. And those are all my questions. Thank you, Dr. Pap.
You're welcome. Thank you.
Thanks, Jen. Any follow-ups or questions from the rest of the team? Because I think we're getting down to our last slide here. Did you want to discuss, Dr. Pap, anything that we had gone over on Monday for order sets? Was there any, now that we've had a few days?
Yeah, so actually one thing did come up because I was talking to both the complex wound clinic nurses and that spinal cord injury wound clinic nurse, because I mean we do dressings there for everybody pretty much, and I'm yet to make an order in any of those clinics while on Cerner, and it's never been a problem. So I asked him, like, how is it possible that you guys do dressings and I don't give any orders? And they say that they don't take it as an order. They just write it down in their own documentation. For example, that Acticoat dressing was placed on the pressure sore. That's it. So there's no order, nothing else. It's just in the documentation.
In that clinic, are you is it staffed specifically by wound care nurses though?
Yes, they are.
Yeah, I think they have a different scope than regular nurses in terms of wound care. So like regular nurses like myself, I could do like a regular dressing change, like a Me-Pour, Mepilex, clean it up, like an Abdo. But when it comes to like more complex ones, that's where we kind of need the order. So I think we need to define maybe where the difference is. And then we have confirmed that sutures and staples do require an order from professional practice.
Amanda, I think we just need to talk about the wound care products offline, because from my understanding, if nurses have the training and the competence to use those specialized wound care products, the actual air quotes scope isn't actually different for a wound care nurse. It is based on your expertise level. There are some things, of course, that wound care WOCN certified nurses can do, like wound debridement and things like that, that a normal not WOCN nurse can do. But I didn't think that the wound care products fell into that category. So we just might want to 1000% confirm that. But you're right about the sutures and things like that.
Yeah, I mean, sutures I get, but I mean, the nurses who are in the burn clinic,
yeah,
they do this like every week, like 10 times a day. So it's never that I have to be there showing or supervising how to put the dressing on. Yeah. I never have to do that.
Yeah, exactly. They have a specialized body of knowledge, just like the nurses that work in the BTHA area.
Yeah.
For us to just bring it back to professional practice to like get the 100% or the 1000% that Lori is asking, what is like the most complex dressing / products that you would use in the burn clinic?
Well, it would be putting a bag on, which they do.
Yeah. When you currently give them an order or tell them to apply a back dressing now, are you giving parameters verbally and then they're writing that down somewhere, or how is that working currently?
I just tell them to put a new back on.
But there's an existing, when you say new vac, sorry, net new vac with like the settings not preset, the suction and everything, is that there's a default that you prefer that they're aware of?
Yeah, I mean, it's always 125 unless I specifically say something else, which it rarely is anything else.
Okay. Yeah, I think that's the piece we'll clarify, Lori.
Yeah, I do believe VAC, I'm pretty sure the policy does specify a physician's order, because I know we made it a PPO for that 3 years ago, but we can confirm. But the other products we'll also check.
If required, we'll certainly build the order with the preset defaults you normally use as something you can select in the order set to make it more straightforward if needed.
Yeah, I mean, I think the whole thing, we just need to figure out how these orders are being done and documented. You know, if there's actually like a whole set of orders that I have to give, then it's the drop-down menu would be the easiest one.
Great, thank you. Was there anything else about the order sets that meeting that we wanted to discuss? Anyone else from the team? Any concerns?
Hi, it's Cheryl. Dr. Pop, I sent you an email with those Word document copies of those 2 power plans we talked about. I hope you received that.
Yeah, I saw it. Yep.
And I think I gave you a deadline of next Friday. So hopefully that's enough time for you to go over them.
We'll see.
Okay, thanks.
Thanks, Cheryl. Okay. Is there anything in the system that you wanted to see, Dr. Pap? Are you pretty satisfied with
No, I'm good.
last call?
So when are we gonna get an app on our phone?
You
working
provide
on
the
it.
$1 billion, yeah.
We're working
You-
on it.
Because I visited Seattle 2 Fridays ago and they have Epic. And it
Yeah.
is unbelievable how much easier it is. Everybody has it on their phone, like you have your burn clinic calendar on your phone, you just click calendar, all the patients show up, no login, click on the patient, everything opens up. You can scroll pictures, you know, back to 2017, whatever. Everything is there. It's just click, 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 everything is there. It's so easy.
That sounds wonderful. Are they placing orders on mobile apps as well?
Yep.
Oh, interesting. Yeah, we're starting a pilot, I think in the next few months for a mobile app for Cerner.
Yeah.
But it's a pretty limited pilot first, just because of some of the things we have
Yeah, and
to
like
go through.
clinic
But
notes, they just, you know, they open the calendar, click on the patient, dictate on their phone, click, done.
yeah, excellent.
Okay,
Goals for the future.
definitely. So next steps for this clinic. I already had the order set session on Monday here, and today is our session with you. Next week, we will meet again with the rest of the clinicians for burns, for nursing and allied, to have their design session. And then at the end of March, there is again the clerk design session as well. So there's a few more meetings coming up. So we'll be organizing that as we come along the process. In the meantime, yeah, we'll send out a summary of today and any further follow-ups that we require from yourself. Is there any other additional questions you have? Concern?
No, I don't have any.
That sounds great. Anyone else from my team? I'm glad that we were able to get through our meeting today in such a efficient way. And I will give everyone back some time. Thank you for joining.
Okay, thank you.
Thanks.
Thank you.